Luke Attkins and Don Williams here from the Institute of Sports and Slides. Now Don, with the current health situation and economic downturn in the population these days, what are we doing here at the Institute of Sports and Slides that's helping our patients?
Well, certainly we're in a current climate of health and economic stress for the majority of the Australian population. COVID-19 is having a significant impact on the movements of people and their ability to go about their normal lives. Obviously, it's giving people great concerns about their safety and their risk of serious illness or even death. So in Institute of Sports and Science, we try to be on the forefront of this from the start, implementing all the decisions of the health department. We have always sanitised all the couches in between every patient, but we've taken our sanitiser to double its strength and we're running on a full alcohol, pure alcohol base, so in the end it turns out about 95% alcohol, so it makes it way stronger than it needs to be, but as a precautionary measure, we feel if we can do everything we can, it ensures the safety of our patients and our staff. Most of our hands-on practitioner staff, because they're within that 1.5 metre space all day long, we're wearing face masks and gloves, and as you can see, we've got some custom covers for our face masks to make them look a little bit prettier and a little bit more comfortable for the practitioner. You've probably seen the advice that face masks don't necessarily reduce your risk too much. If you're just walking down the street in public, you really don't need to wear one. It's not like it's floating around the air for hours and hours at a time. But when you're in a face-to-face consult, it reduces the risk for our practitioners to quite a degree. But furthermore, if our practitioners have contracted the virus and are not aware of it, it dramatically reduces our retransmission to our patients. So our thoughts are a little bit of discomfort for our practitioners reduces the risk for the patients quite dramatically if we are a non-symptomatic carrier in that interim before we can self-isolate. We haven't had any cases at the clinic yet. We're asking any patients with any symptoms or any risk factors to reschedule their appointments for a fortnight, go into self-isolation as is expected by the government health department. We've spaced out our waiting room. We've also put in a second waiting room at the rear of the building for the practitioners down the back to create more spatial separation. We're sanitising our tyro machine and our terminals and our desks between every single patient so that anything they use, the pens, are all sanitised. So we're really managing those risks as much as we possibly can. In addition, some people are under financial stress at the moment, and our view is that financial barriers shouldn't be a barrier to someone achieving good health. So we're looking at strategies we can implement to try and help people through this, looking at strategies for Medicare, work cover, insurers, DVA, what access do they have, and then if that's not a capacity, what other structures or strategies can we put in health at the clinic to help them through that. And so certainly if you need an appointment and you cannot afford to pay for it, call us up, we can talk to the practitioner and work out what we can do to facilitate your visit. So they're the main strategies we've got in place at the moment, and we're certainly open for business. The whole team are here, we've expanded, we've now got acupuncture 4 days a week from Monday the 27th. David, who works for us doing massage, is AHPRA accredited, so he can actually continue with his appointments wearing PPE, gloves, masks, with separation. Our chiro and physio and remedial massage and nutrition team are working as per usual. We're also offering telehealth consults so that if you want to go through your nutrition plan and not come in at all, Max can facilitate that. Emily's running classes through Zoom. We've got Pro Zoom now, and we're running classes to facilitate your exercise programs at home. Practitioners can go through your rehab programs and things while you're in the safety of your own house as well. So we've got a whole range of different measures in place to help you continue with your healthcare goals.